This conference will now be recorded.
Good afternoon, everyone. This is Jose Leon, Chief Medical Officer for the National Center for Health in Public Housing. Thank you so much for attending this live activity, COVID-19 and diabetes, challenges and opportunities to help vulnerable populations. It's such a great pleasure to see that you are staying well and healthy during these difficult times. And the idea of this meeting is just to have a conversation about challenges and best practices that you are seeing with your patients, with your diabetic patients. And at the same time, share that information with other health centers that may be having the same kind of issues so they can implement some of the promising practices that you have in place. Just as an introduction, we can just briefly go over the chronology of COVID-19. If you remember, on December 31st, the last day of 2019, China alerted the World Health Organization to several pneumonia cases of unknown origin. And on January 7, France confirms Europe's first case. On January 11th, China announces the first death. So it took around 11 days, almost 12 days for China to announce the first death. And 2 days later, on January 13th, WHO reported cases in Thailand, which was the first case outside China. On February 7th, Chinese doctor whistleblower Li Wenliang dies. And on February 2nd, the first death outside China is recorded in the Philippines. On January 30th, WHO declared the outbreak a global health emergency. And it was almost 45 days after when WHO names the virus as COVID-19. And on February 14th, Egypt confirms Africa's first case. And if we keep going and looking at the timeline, then we have cases in Italy, Spain. On February 1st, the United States announced the first case. And since then, the United States has been the country with the largest number of cases and the largest number of deaths due to COVID-19. As you know, this has been very challenging for health centers. First, because health centers had to adapt to the new condition and somehow respond to the emergency. As a result, health centers, most of the health centers have established protocols, established guidelines and testing sites. But at the same time, they had to accommodate how they are going to provide health services to patients, not only those with symptoms of coronavirus, but those with chronic conditions, including diabetes, hypertension, COPD, asthma, and the variety of chronic medical conditions affecting vulnerable populations in the United States. So today we are going to discuss some of the challenges and limitations that we have seen, that we have discussed with some organizations, as well as some of the promising practices that we also have gathered from some of the health centers and some of the organizations working on diabetes prevention and management. So I hope that you can also share your experience. I hope that you can also discuss with us some of the challenges that you have had and how you are addressing those challenges and what promising practices you are putting in place. From the provider perspective, there have been some challenges and limitations. In a recent conversation with the American Diabetes Association Primary Care Advisory Group that we had a few weeks ago, we discussed some of the issues concerning COVID-19 and how COVID-19 is affecting the population they serve. One of the points that were highlighted was the fact that some populations are more likely to be affected by COVID-19 than others. So the Hispanic population as well as the African American population in the continental USA have been more affected and they are more likely to have severe symptoms and more likely to die of COVID-19. In regards to some of the issues that they have discussed with patients, there have been some positive changes as well as some negative changes or from patients. Some patients are reporting that since they are at home, they are better planning their meals. However, some patients have also expressed they are having more issues, more psychological issues such as stress, anxiety, depression, and this is due to the isolation, the quarantine, and the inability to be outdoors. For some of the patients with diabetes who exercise, they had to change their exercise protocols. They are now exercising indoors instead of outdoors. But with the social distancing, it's more difficult for them to go outdoors. So this is some of the issues that has been reported by some of the experts at the American Diabetes Association. So basically, what they're saying is we are seeing that patients with diabetes who are either Hispanic or African American are more likely to be affected by COVID and at the same time more likely to have severe symptoms. And then some of the issues that we're having is that either they are overindulgent and they are eating due to the stress, or some of them are eating healthier. You know, they have more time to cook, they have more time to prepare food, but most of them are expressing some kind of psychological issue. Again, we have seen cases of people are reporting that they are drinking more alcohol, they are smoking, or they are suffering from some symptoms of anxiety, depression, and stress. One of the issues also affecting patients with diabetes during the pandemic is that there is a lot of information out there that is difficult for them to digest. Specifically, we are now they have to deal with new terminology, and remember that some patients may not understand well the issue. So there are new words for patients like outbreak or pandemic, or the fatality rate, or incidence and prevalence, or social distancing. And what is a case definition? What is an outbreak? What is the difference between an epidemic and a pandemic? So one of the recommendations is that when you have conversation with your patients, you need to empower your patients with information and discuss any doubt that they have, in addition to talking about these, in addition to talking about the condition. There is a very good way, this is a very good opportunity to educate your patients, to let them know that the disease, even if they have diabetes, but if the diabetes is well controlled, is not going to be like a death sentence for them, because we have heard that the COVID-19 that you can experience severe symptoms if you have a chronic medical condition, if you have a heart condition, you are diabetic, if you have chronic failure, if you have any other, if you have cancer. And recommendation is that for patients with diabetes, if the diabetes is well controlled, the risk is about the same that any person with no diabetes. So I would like to stop for a moment and see whether we can have a brief conversation with Silke. I'm not, Silke, if you are on the line, what you
Yeah.
are seeing in Puerto Rico and what you are hearing from your patients in regards to what are the challenges are in Puerto Rico for patients.
Well, especially in Ponce, not only COVID, we're having earthquakes. We have one last Saturday, 5.3. So we can see our patient. We are doing the medical visit by FaceTime since March. We are in quarantine by the government. This week is the first time people can go out freely, more freely, and the malls are being open. Uh, we think when they came back, we're gonna have problem with the diet, with the weight. But they've been having the adherence. They take all of them their medication for 90 days. We give it to them in March. So at this point, we don't know their feedback already.
Okay, thank you, Silke. Silke, I just have some following questions for you, and it's my intention to put you on the spotlight. But Puerto Rico is kind of particular because first is an island, and second, there is no, I mean, we don't have too much information about how COVID has affected Puerto Rico, you know, if whether you are seeing a lot of cases or a lot of deaths. So what is the situation in Puerto Rico right now?
But the development of the pandemic is being slow here, thank God, because we start with measuring in February, but we have 1,924 cases positive, confirmed by the government, 99 deaths. That's for today data for this morning.
Okay.
In the clinic, we only have two positive cases, and none of them were diabetic patients.
Okay,
They didn't have symptoms.
so the patient were tested and were the patient asymptomatic, Silke?
They were asymptomatic because they came, both of them, they're females, because their husband has symptoms.
Oh,
Uh,
okay.
we test them and they were positive, but they didn't have to go to the hospital. We give them the treatment and home quarantine.
Okay. And now in regards to the to Med Central, how have you responded? I mean, do you have like a tents for
Yes.
testing? Okay.
There was a total change of the way we practice medicine. It's the first time you feel like you're in a war zone because everything changed. Even the employees have to be checked out before they enter the center. Their temperature, they have the specified questions about traveling. We already don't know that question. Everybody have to have a mask, a face mask, even the employees and the patient. We shut down the appointments. Everybody have they can see their physician, but by FaceTime or by the computer or by phone calls. We're gonna start seeing patient again next week, but
Okay.
we put it down. They're gonna be like 6 patients per physician per day. We
Okay.
don't want any patient in the waiting areas.
I understand. And then before I go on, Silke, the
And
last.
we have the ER is outside in the tent.
Okay, all right. What have you seen a spike in the number of psychological issues in
Oh
the
yeah,
patients? You know, I mean,
yeah.
one of the well, most of the reports that I've seen, and when I have conversation with other colleagues, it seems that anxiety, depression, you know, even smoking on the
The
alcoholism is
I
I
have
mean,
two
these
psychiatrists.
conditions are going up.
Yeah, I have two psychiatrists and like seven psychologists, and they're not enough to give attention to all the patients that have been calling to them, the depression, the anxiety, because it's not only COVID-19 in the south part of the island, that is Ponce, where our center is. The earthquakes are taking off out of our feet also. So we're attending a few emergency at the same time.
Okay, thank you, Silke, for the update.
You're
Um,
welcome.
and then it's I mean, it's been challenging for public health to somehow respond to COVID-19 after September 11th. We had an increase in the in funding for public health emergencies, but there have been little understanding of the work of public health organizations dealing with emergency preparedness and emergency management. And sometimes there is healthcare, and you know, primary healthcare and public health, and research, and the others working on prevention. I mean, it looks like sometimes we work in silos, and is not is a very good opportunity to coordinate activities and making sure that we are addressing the needs of those who are suffering from COVID-19 and from those who really have other social determinants of health. So that is one of the challenges. The other challenge that has been discussed, and I was reviewing some literature today, is that 35% of the population have gained at least a pound. You know, even though it's not like a lot, is something that we need to pay attention to, because due to the pandemic, due to the isolation, we are not exercising, and we tend to eat more. So this is a huge concern for the diabetic population. Now, from the provider's perspective, there are some challenges as well. I mean, not only the patients with all the things that they have reported are having some challenges, but also the providers. And one of the issues is how to deal with virtual visits, how you are going to assess your patients with diabetes, what you're going to do with them, and how, on what program or what recommendations you have for patients to keep them on track. So you can provide the prevention service of the management services to patient somehow, like if you had an in-person visit, but now with the pandemic, we are switching to virtual visits, and as Silke mentioned, we now have either FaceTime or phone call with patients, and sometimes it's very difficult to really assess the patient. The other issue is how you are going to assess other issues that is not that are not just the chronic medical condition, but the social issues, the social determinants of health. So this is another issue and another opportunity to really discuss with patients about whether or not they are working, if they're able to work from home, if they are working, if they have been furloughed or if they have been, if they don't, if they have other issues to access, for instance, medication. So the other issue is how to deal with low health literacy. I mean, it's not the same to explain to a patient in person some instructions like when, or if you have a virtual visit, it's harder to have this conversation with patients. The other issue is some dietary challenges, how patients can access to healthy food and how you can inform patients how they can go about and get healthy food, because right now is difficult to go to a supermarket and get produce and food that is the kind of food that everybody needs, but a patient with diabetes needs more. So these are the challenges that providers are having. And the other one that it was mentioned during a conversation as well is the need to have interpreters if you are having some virtual visits. Probably this is not an issue in Puerto Rico, Silvia, but here in the continental USA, US is for those patients who are Spanish speakers, and there is the need to have interpreters, and it's difficult to have the interpreters during these virtual visits. So these are some challenges expressed by the providers. So I see that we have Ms. Harris on the phone. I believe she is from San Isidro, and I'm not sure if she would like to give us her perspective if she's still on the line.
Hi. So I'm actually not frontline. I work in our quality management department.
Okay. All right. But what is your experience in San Isidro? For instance, how hard has impacted COVID-19 the population in San Isidro?
So we've definitely had an impact. We've shut down, well, we've consolidated some of our clinics. And so, we're not running at our full capacity, and we are, a lot of our visits have turned over to the telehealth. And so, that's definitely been an impact to our population.
Great, thank you so much. And another question is, in general, I mean, California has reported some, I believe, if I'm not sure if probably the third state with more cases or the fourth state with more cases.
It's the fifth, Doctor, this is Sonia Tucker, is the fifth, up until last night, was the fifth state with most cases, the second state with the most number of testing, but one of the lowest number of deaths. In San Diego County, where we are the third county in California with the most amount of cases of positive for COVID.
Oh, thank you, Sonia. I mean, that's good to hear, and thank you so much for chiming in. And Sonia, what are the challenges that providers are having now to provide services to patients with diabetes? We went over some of the challenges like health literacy.
I've been on the call, so I heard, especially for us, we have been quite affected by the number of languages spoken and being able to have the virtual visits taken into consideration that we have to have a translator. However, La Maestra has cultural liaisons. Some of them are still present at work, so we have come up with very ingenious ways of having three-way phone calls with patients and cultural liaison and providers at the same time. We have been using the cultural liaison more to the capacity of case management, So that way they can communicate directly with the patient. And if we need to have that three-way phone call, it has been a little challenge for virtual visits, especially taking into consideration the platforms that we're using. The platform that we are using now does not accept the multiple people at the same time, just like Zoom, for instance. Zoom is a platform that you can have a translator and a case manager and maybe somebody else in the same visit. The platform that we're using, not so much. So that has been a little bit of a challenge, but that's when we have decided to go with phone calls where we can have a three-way.
Okay, that's good to know, and I mean I am very pleased to hear that that's an issue that has been addressed by La Maestra in San Diego. You know, because as I mentioned early, one of the issues that were mentioned during a meeting with the American Diabetes Association was the use of interpreters. You know, when you have virtual visits. So I am very happy to hear that that's something that is being covered by La Maestra. Now,
well, we're trying. I'm not going to say that we're perfect, but we're trying.
You know, and in regards to some of the other challenges that patients are reporting is technology challenges. Not all patients can just use technology. You know, and the other challenge is the access to the internet. You know, not all patients have access to the internet due to either some issue with funding, you know, the money, or because they do not have access where they live. Either we need to keep in mind that there are some health centers located in rural areas where access to the internet is more difficult. The other one is how to have these telephone appointments and the video visits. The issue of food delivery, and this is especially for the elderly, you know, who probably are quarantined and they have fear to go out and get healthy food. And the other issue is fear to go to the clinics. Some patients with chronic medical conditions prefer not to go to the clinic because they know that at the clinics that they are testing patients that may have COVID. There are other issues such as access to medication. Some states have reported some shortage of medication, and this is a very sensitive issue as well, which is the public charge rule. And patients I mean, they don't want to get tested. But patients with diabetes don't want to get tested for COVID-19 because they prefer not to because of the public charge rule. So those are some of the challenges that we have collected from other centers, and I would like to hear from Sylvia, for instance, if there is any of these challenges that I mentioned that is affecting the population in Ponce, Puerto Rico, either technology challenge or problem with food or the health literacy, low health literacy issues, for instance.
Well, we don't have it a lot. We haven't the earthquakes. We don't have it. We haven't lost the internet or energy or water. So in that part is okay. But when the patient can come here and they call and they need to be seen by a physician go to their home and with a nurse with all the equipment, protection equipment, and they check the patient. We have two physicians that are doing medical home visit.
So MedCentro is providing health visits, Silkia, and
Yes.
is there any issue with the personal protective equipment? Do you have all the PPE that you need to go out and
No,
get the services?
no, we don't have everything. That's why we send like half of the employees in vacation. So
Okay.
only the first responder use the equipment. so it could last more than 2 months.
Yeah. Okay. All right.
We're trying to buy from everywhere, but it's been difficult.
Yes, the access to PPE is getting difficult.
Yeah.
There was something else that it was mentioned on the survey that health centers or the responses to the survey from HRSA is even the to get some disinfectants
Hmm.
is becoming an issue for some of the health centers.
But thank God we one of the distilleries for alcohol here, they stopped doing alcohol for beverage and they start doing the hand sanitizer and they give it to us free.
Oh, okay. And is are they providing the alcohol as the hand sanitizer or
Yes,
just? Oh, okay.
they use the alcohol for hand sanitizer, not for the beverage. They stopped doing
Okay.
it
Interesting.
and they give it free for the south part of the island.
Excellent. What about La Maestra?
In regards to the problem with
The-
PPE or
no, in
or in
regards to
general though?
the challenges that patients are having that to
Oh
access.
my gosh. There are a lot of challenges. So, you know, the first of all is the mental health and the fear of really having to get out, if they have to get out, to either buy food or, you know, come for a blood work. So we have tried to come up with solutions. So one of our departments, our health home program department, has decided that for their patients, part of what they do is they deliver food once a week. The case managers deliver food to their patients so that they're able to at least provide some kind of um, healthy choices for them to eat. So that's one of the things that we're trying to, okay, how can we help identify what barriers are, and also what can we put in place to overcome those barriers? So that's one of the things that we have done. The other one is having the food pantry available and
Mhm.
open. So we did not, and we didn't close the food pantry. So what we decided to do was keep it open, as well as, I'm sorry, I'm waiting in area in 95 and running back and forth. Um, keeping open, and also we have partnered with the food bank to provide healthy and warm lunches for the people that live in the area where we work. So other challenges that we're having besides some patients, what we have encountered is patients that come to the clinic to pick up medication. All of a sudden, they're just crying because they are overwhelmed with the amount of information that is out there and the negative information about COVID-19. And sometimes the health literacy doesn't help. A lot of this information that is being put out there is at a high school or college level. And most of our patients in general, the health literacy is at third, fifth grade level. So having to meet with the patients. So we have nurses in the screening areas educating the patients. We have a lot of case managers still available so that they can call. The other part that we have done to try it as much as possible, to overcome the barrier of the mental health that we are seeing, is making wellness calls. So I have staff calling patients and checking with them, even if we haven't seen them within the last 2 years, making sure that they know we're here if they need any kind of mental health. So we immediately put them in contact with our mental health case managers to see if they want to talk about what they're feeling. What else can they do? Transportation has also been a big problem. I mean, it is a social determinant of health, but if you add COVID and transportation together, a lot of our patients take public transportation. So there is that worry of getting into a public transportation. What can I do? And some of them, they just don't go out to buy food, even if they're not at high risk or not in the high risk population group. So we're trying to educate everybody how to
still kind of take life, but it's still healthy. So don't touch your face. Make sure that you wash your hands all the time. We're giving them ideas on how they can make homemade masks. You should be wearing your mask at all time when you're in public. And, just trying to really take things easy as much as possible, trying to decrease the number of visits in person to the centers, but being available for them either via email, patient portal, virtual visits, and phone calls. So and also telling them that if they have to be seen in person, because some of them they have to be seen in person, that we have a whole process where we screen everybody so that we ensure everybody's safety within the clinic.
Excellent ideas and practices from La Maestra. And in regards to the materials and resources that you mentioned, and I'm going to stop for a moment. I believe that I will have to advertise ourselves. We've been working on some infographics, trying to provide information that is patient specific, especially for those either living in public housing or those experiencing homelessness. Trying to make the infographics easy to understand, and at the same time providing some links, and probably this is something that we will have to discuss later with some of the health centers, on how to wash your hands, some specific videos on how to wash hands effectively, and how to make a face mask. So if I'm not mistaken, those are some of the issues that you mentioned and that we have addressed, so hopefully we are going to have this out probably by early next week, and they're going to be in English and Spanish. So I will send you
beautiful.
some copies.
Oh, awesome. Thank you, doctor.
You're very welcome. And then in regards to telehealth, on the virtual visits, some patients have experienced some technical problems, either because they are unfamiliar with the technology or because they are not computer literate, or some patients believe that telehealth is not like the best way to communicate because they prefer in-person visits, or they consider telehealth unnecessary sometimes. Others have expressed anxiety due to the technology, they have the same issue. They have the computer literacy probably is not something that they do on a daily basis, so they have some issues accessing technology. And others, specifically those who are over the age of 65, have expressed as difficulties on how to interact with the system. Even if they receive instructions, it's difficult for them to remember the instructions and interact with system. And others, need technical support. And this is something repetitive. This is something that you have to do in order to get familiar with telehealth. Silkia, in Puerto Rico, are you guys doing more telehealth with video conferencing or more phone calls?
More phone calls, because our population is older than 60, the majority of them, and they have technical difficulties with the FaceTime, with the intelligent phones. So they make a call, they can come here. We can see they're here. We explain that to them, but the government prohibited that they visit or get out of the house. The quarantine here, it was very stricted. So that's have a promotion for the technical use, and say go because everybody's at home, so their children help them to use the technology. And those who cannot use it, they make a phone call or try to use telemedicine, and we go to their homes.
Great, thank you, Sylvia. And what about La Maestra? I mean, are you using more telehealth or more, I mean, video conferencing or phone calls to?
We're doing a combination of both. It depends on the department and the provider. We are doing telephonic visits, and in many cases, we start the visit as a telephonic visit, and we end the visit as a virtual visit. We have three platforms going on at the same time. We're using Auto, which is a platform that interacts directly with our EHR. We are using WebEx as well as Agnes. So Agnes has been the oldest platform that we've used for years. I've been here 7 years, so for 7 years we've used that platform. And the only issue with Agnes is there is no capacity to have Agnes well, there is a capacity, but it's very technical to have the patient connect from home. So what we have experienced is some of these platforms, there's two issues. Is the user error, that's what I call, so whether it's the provider or the patient, as well as the technology per se. Because even though California, in San Diego County specifically, they have given patients with low income free Wi-Fi or free internet for 2 months, started for 2 months. I don't know if they're going to extend that. And what we have done, part of our case managers, is connect those patients to those resources so that they're able to use their phones, even if they don't have minutes, so they can connect it to Wi-Fi. We utilize a lot of the young kids in the house to help the parents. So, and that has been quite effective. Having a teenager just help a grandma or a mom to connect for video conferencing. So the issue has been is, even though they might have the connection, they might have the equipment. If the equipment doesn't have the latest technology or the latest platform or the latest update, in some of those technologies, you're not able to do the video visit. You might be able to do the audio visit, but not the video. So since we have three platforms going on, we have been trying to troubleshoot each platform and collecting information and kind of informing the people with the platform, what else they need to do. In regards to, a lot of people I know are using Zoom as part of what they use to connect with patients. The problem that we have with Zoom, it has a lot of steps that they need to do, and it doesn't have for HIPAA and confidentiality purposes, I really like the one that we're using because it gives us the opportunity to collect the agreement for treatment, as well as that they agree to be seen via telehealth, and that doesn't have to be pre-typed by the provider. So the problem with Zoom is that you also have to give the patient a code, or you have to set the patient in. Some patients have to download the app. And those are steps that are a little difficult for them to do. How we have overcome that is trying to set the expectations right for the patient. So really, for us, it's worked better when we start the visit via telephone, whether it is with a provider directly or with one of the MAs, and kind of direct the patient step by step on how to utilize and how to connect with the provider. It's far from being perfect, but at least we have been able to see patients face to face when we need to see them. So that's basically what we're. And in regards to telemedicine in general, we have about 60% of the telemedicine visits are telephone, and about 40% are virtual or video.
Okay, that's interesting. Now, what is the name of the platform again? Is Agnes? Is that what you said?
Agnes is the one that we've used for some time, and it's a really expensive platform.
Okay.
It's really good though. It's the platform that they're using, that we have been using with Rady Children's Hospital for some time now, and it has all peripherals. We still use that because we have providers that, for whatever reason, whether it is because of chronic conditions or whether it is because they have because they're quarantined and they still need to see their patients or want to see their patients, and the patients are healthy, like the diabetic patients, we're still seeing patients that are diabetic in person. Some of them, the ones that need to be seen. And so there is a provider that is working remotely that sees those patients via telemedicine through Agnes. And with that particular, it's a cart. And with that cart, we're able to do full vitals and full physical exam because it has scope, stethoscope, otoscope, and it's really good to use.
Excellent. Thank you. Thank you for that information. Now, in regards to some promising practices, let's discuss some promising practices. This information was another discussion with other clinicians, clinicians serving in private practice or serving health centers. And one of the recommendations that we got from them was that we need to empower patients with diabetes with accurate information. And we discussed the need to somehow decrease the level of anxiety by providing accurate information, recommending patients to review sources and getting information from valid sources and from approved sources, because there is a lot of information and a lot of treatments that are being discussed that probably are not, or if patients are not getting that information from approved sites. I've seen a ton of remedies that are more like natural remedies that there is no evidence that they are going to work or they work against COVID. So this is an opportunity for health centers to empower patients and educate them on COVID and how they can prevent the condition. Now, as we have discussed, the use of video conference and telemedicine. Others have mentioned after hours phone visits. Some of the patients have to work because they are considered workers that need to go to work. To provide services. The other thing has been the virtual shopping, teaching patients how to. If they have a chronic condition, if cannot go to a supermarket, how they can connect. And so they can get food at their door through the virtual shopping that is offered by many of the supermarkets. And the other issue that has been important is to discuss all the social determinants of health affecting patients. We're discussing about employment. We were discussing that some patients have been furloughed. How the patient can have access to healthy food. We discussed transportation. So those are the kind of promising practices. There is also something that I would like to share, and is the ECHO clinics. The ECHO clinics, the project ECHO is providing an education program on diabetes and how clinicians can get in contact with patients during the pandemic. And they have another program, which is the peer support coaches, which is some training for outreach workers or for cultural liaisons, so they can go and learn about food programs and technology and how to get in contact and how to do outreach during the pandemic. Then the recommendations as well mentioned to provide mental health support, offer community resources, offer educational materials such as infographics or one-pagers or fact sheets, so patients can inform themselves and get accurate information from the health centers. Then the need for the healthcare team as a whole to get connected, to have if you have a patient with diabetes, but the patient is experiencing some psychological issues or some behavioral issues, then and they need behavioral intervention, make sure that the patient is referred to the appropriate resources so the patient can get behavioral intervention, or if the patient is referring that they are not having healthy food, get in contact with a dietitian or with some of the outreach person so they can restructure the diet of the patient and based on the needs, based on the supplies that they have in the community. And then the other thing is to assess the medication needs and make sure that the patients have enough medication. And if not, try to work. And if some health centers and some organizations are reporting that there is some shortage of some of the medication, make sure that you work with community partners and food pantries and pharmacies to make sure that the patient have access to the medications that they need. So I believe that we have discussed most of these promising practices. Is there anything else, Silkia, that you have in place in Puerto Rico that as a promising practice that other health centers may put into practice? Probably we lost Silkia.
I haven't trouble with the audio, sorry.
No, that's okay. That's okay. I mean, is there anything in particular that you have developed for your patients during the COVID-19 pandemic, and how you are reaching out to your patients, to your communities? I mean, you mentioned the in-person visits that you have healthcare workers going to the community and offering services in person, which is extremely useful patients. Is there anything else, Silke, like are you working with community organizations or the government or anything else?
We're working with several organizations here. Also in the States, they give us some funding for testing or equipment for the patient. We can deliver the medication to their homes. They don't have to come here to the pharmacy. That's another thing that we're doing. But about food, we don't have any we don't provide any type of food or stamps. We don't have that program here.
Okay.
But in Puerto Rico, there is the food bank, and they can give food to people. The case manager can make the connection with the patient if the patient requested.
Thank you, Silke. And Sonia, any last comment, anything, any promising practice that you would like to share? Probably we lost Sonia as well. So, well, you know, I know that Sonia has been very helpful. She's been participating in other activities. We recently had a live webinar with Sonia Tucker and Dr. Rodriguez, and they were wearing the masks, you know, the N95 respirators, and they were very kind to participate in one of the live activities that we do. So I am quite sure that Sonia may be overwhelmed with all the activity that she has to do. So I just want to invite you to visit our website. We have new publications. We have information on publication and upcoming activities. So if you have time to go to our website, www.nchph.org, you can receive information about upcoming activities, funding opportunities, resources and services, or you can contact us at any time. Our phone 703-812-8822. You can reach out to any of the NCHPH staff members. I want to thank you again for participating on today's call. Have a great afternoon, and I believe it's still great morning in San Diego. So thank you so much for your participation.
You too. Take care.
Thank you. Bye.
Bye.